Namaskar, हजुर सबैजनालाई. Good evening, good morning from who are joining from around the globe. My topics is a little bit different, but I think this is going to be interesting topics for all of us. We have children, we have women's right in our family, and we are also thinking about the global health. So my name is Sangeeta Purasani Kapri. I'm an assistant professor at Rutgers University, Camden. I'm also a president of Nepali American Nursing Association since 2022. On behalf of my team members, I'm going to present our research findings and the topics relate association among low birth weight, postpartum depression, and mother-infant bonding within 6 months of childbirth in Nepal. So those are the learning objectives. I think I'm going to skip that part because I'm going to cover them in a sequence. So first I'm going to talk about some of the prevalence, like where we are in Nepal and what is the global prevalence of low birth weight and then postpartum depression. Globally, about more than 20 million infants are born, less than 2,500 grams birth weight, in which 1 in 12 babies, about 8% of live birth was low birth weight in the US, the United States data. In Nepal, because of the significant issues with home deliveries, we don't really, we can calculate the national estimates or national prevalence of low birth weight. But from the current data from UNICEF and WHO, Nepal has the second highest prevalence of low birth weight in South Asia and third highest prevalence of low birth weight in the world, which is a significant issue when we are thinking about reducing infant mortality and also in terms of the postpartum depression, which is contributing to maternal health and well-being and maternal mortality. As we can see here, as compared to the global prevalence, some of the studies conducted in Nepal showing we have more than the global prevalence of postpartum depressions. And I can't really tell you that. I don't really think this is a representative, the populations that we have, we can catch up from different geographic areas. So this 30% the maximums which we have a data. This is not, I don't think this is a representative for all our postpartum moms. Why this topic is important? So low birth weight or preterm birth. So low birth weight can be happen due to preterm birth or intrauterine growth retardation. So the babies who are born low birth weight, they have then the research has identified there is increased risk of postpartum mental health issues among moms, including anxiety, depressions, or other mental health issues. And especially those who have a low birth weight babies or who have a preterm birth, they have higher risk for having a mental health problem as compared to having normal birth weight babies because of significant problem like developmentally and also the increased demand taking care of those babies. Low birth weight has been also associated with impaired mother-infant bonding, which is very important for their neurodevelopmental outcome, their cognitive outcomes, academics, because we always think about the long-term development of our babies. So this is the topics is also very aligned with our sustainable development goal, in which goal 3 discussed the ensure healthy lives and promote well-being for all at all ages, and it focused basically the reducing the maternal and child mortality reduction. As you can see all those numbers here, the targeted number is very far for us to reach to that goal. So the research, the main gap that we found from our study is, although there has been some study conducted and looking at the prevalence or risk factors for depression, there is none of the research has linked and examined what's the effects of low birth weight on postpartum depressions, and also how those postpartum depression and low birth weights link to mother-infant bonding between 1 to 6 months of postpartum period. So the purpose of our study was to examine the association between birth weight, postpartum depression, and mother-infant bonding, and to identify whether low birth weight serve as a significant risk factor or moderator in the link among these constructs. This is a cross-sectional design. We use convenience sampling technique to recruit 128 postpartum mothers of an infant between 1 to 6 months of postpartum. And we collected data through the immunization clinic of Kanti Children's Hospital and Tribhuvan University teaching hospitals. And we finished our data collections in summer of 2022. And we used the semi-structured interview. I will tell you why this was selected, and we use the data, this data to conduct our data analysis. We have used some of the standardized version of the questionnaires, but one of the questions, the postpartum bonding questionnaires, we also have a validation study going on this, and I think we will publish that soon. So we use the cross-cultural recommendation for validation and translation of the postpartum bonding questionnaires that was used the first time in Nepal. And we also use the Edinburgh Postpartum Depression Scale, which is a widely used scale to measure postpartum depression after the childbirth. And then our ethical, after we received the ethical approval from Rutgers and Nepal Health Research Council, we finished our data collections. I'm going to focus, due to the sake of the time, I'm going to focus the key results, but I'm happy to explain any questions that you have later on. So our populations, the sample was ethnically diverse, in which 50% were Brahmin and Kshatriya, but we have the fair other, about 50% of the population from Janjati, Madheshi, and Dalit group. Mean age of infants was 2.75 months, but we cover from data from 1 to 6 months, but the majority of them were 2.75 months because we collected data from immunization clinic and we cast the population when they were there for the DPT. About 59% of our participants had a cesarean delivery. I know this is, I think, the significant problem having the cesarean delivery, but because of the population that we covered, the low birth weight and preterm, I believe that was also the reason of having increased cesarean delivery in our populations. We do also have about 28% of our participants who have less than high school educations, including we have some illiterate from that 25.7%. The good thing, good news, I think this is, we have to comment some of the good things. 97% of our participants was breastfeeding or feeding from breast milk. But the other caveat is we also have some issues during the pregnancy time. So we have about 35% participants reporting having anxious or depressive thirst during the pregnancy. So those are our descriptives. So I just give you a quick, the key results. So for our finding, based on the postpartum depression scores, about 9.38% participants made the criteria for referral and evaluation. So in our team, we had a psychiatrist from TUTH, where we refer our participants who scored higher EPDS, because that's also very important for us. We were not only doing a study, we also identify population at risk and refer them. But I want to get your all the attention in the moderate level, so which is considered number 9. So EPDS 9, they are not really ready, they are not considered ready for the referral, but those who are 11.7% of our participants were closer to the demarcation that they were ready for the referral. We did control several variables in our models when we were tested hypothesis. And our first hypothesis consistent with our propositions, birth weight was significantly associated with postpartum depression. We use both the continuous variable of birth weight as well as the categorical variables, and those both were significantly associated with postpartum depression among mothers. The results also indicate infants who have below 2,500 grams have 1.311 units higher PPD scores among mothers compared to those who are normal birth weight infants. So what we find is higher level of PPD was postpartum depression was significantly associated with increased mother-infant bonding issues among postpartum women in Nepal. But we didn't find the correlation between association between low birth weight and mother-infant bonding. It could be some of the cultural things, so we have discussed them in detail. And we also did not find the significant association for the interactions between low birth weight and postpartum depressions to predict mother-infant bonding. The the noteworthy conclusion from our studies, low birth weight was associated with increased postpartum depressions, which can be linked with increased developmental vulnerability, because not all the, like when they have a postpartum depression, mothers can't really provide the bonding, like the need for the infant was like for care, taking care, like care of the infant, engaging, like gaze, all those kind of things, and their affect will be disturbed. So those can also impact the child's socio-emotional well-being, and higher level of postpartum depression can serve as a significant risk factor for increased mother-infant bonding, which is foundational for infant developmental outcomes, and that's also can carry on when they are like older. So the of course, there are some limitation of our study. There is a possibility of recall bias or social desirability bias. And I also mentioned in the initially that we did the semi-structured interview, not the self-rated questionnaire. So during the semi-structured interview, some of our questions had the related to postpartum bonding. There are some questions related to abuse and neglect. So the mothers may not really feel comfortable to tell openly. So those in our validation study, we had to drop some of those incipient abuse-related questions. That could be cultural, that could be not really having a significant issue in our Nepalese population. So we are now conducting another study to see what's gonna be like the outcome for the self-rated questionnaires. And also we can really generalize these findings to all the postpartum mothers across the nations. The most important things is what are the implications. So unlike in the United States or other countries that where we do have screening for postpartum depression, we don't have that in our practice area. So physicians and nurses should identify those postpartum mothers who are at risk for postpartum depressions, and they can identify and timely refer them so that we can avoid all those like negative complications. Also, has a very important implication for policymakers and providers so that they can design some interventions. We don't really have any intervention for those low birth weight preterm birth, like a developmental follow-up. We don't really do the screening. So that's what the next step I think we are thinking now. And some of the community-based intervention, I think that can be integrated in home visit program that we have in Nepal. Future study recommendation from our findings is we think that we need to investigate the mechanisms why those relationships exist, and qualitative research may also need to identify, so the mixed method research may explore the barriers and facilitators of those postpartum depressions and poor infant outcome across these at-risk populations, and also there might be like intervention can be planned based on those findings. Those are our references. I would like to thank the Third NRN Global Convention Committee for providing us this great opportunity to share our findings. Also, we would like to acknowledge our funder and TUTH and KCS Immunization Clinics staffs and psychologists who also help us to translate those questionnaires. And thank you everyone for your time and being here. So I don't know if I have any time, but I'm happy to answer any questions afterwards.
Thank you so much, Dr. Sangeeta Purasaini, for the wonderful presentation. Now I have the pleasure of inviting a renowned personality who is an expert on health and well-being and spirituality. He is Dr. Pramod Dhakal. Dr. Pramod Dhakal has also been a veteran of NRNA and has led a number of projects in NRNA. Dr. Dhakal will be speaking on value of health and well-being. So Dr. Pramod Dhakal, the floor is yours.
Thank you. Actually, I'm no expert, by the way. I'm just a student of all of these things. I am learning myself. Actually, I am actually living in a village in Nepal. I used to work in high technology in computer science, in the field of computer science, telecommunication, etc. in Canada. And then also before that, I used to teach at Tribhuvan University. But now I have given up everything and chosen a different kind of life. And I have gone back to the village where I was born, and I live there, I experience there. And then, so I have buffaloes, I cut grasses, so like that kind of life I have chosen. Actually here, what we are trying to talk is that it's about well-being, okay? the foundation of the healthy humanity. Actually, before me, there were so many speakers. They were talking about the issues that were not related to our actual physical health, and then that were not related to actual, like we try to live long, right? But within that, there are other missing elements, and then I'm trying to work on those areas. And Vishalji was talking in another session the same thing. Actually, let me skip this. Actually, what happens is that, what's happening is that we are in a race. This whole world is on a race. As a result, so we are seeking so much physical and economic well-being, This is so well known. And then whole globe is about, in all the, even this convention in general is about that. How we can be wealthy, how we can live long, and then to be on top, We have to be on top, isn't it so? Like, to be first. In fact, that's what was the corporate culture. Where I was working for how many years, where I lived in foreign countries, it is the life, And then, so what happens that we are at war. Actually, we are at physical war now, The country that are the most educated, they are at work. They are taking arms and killing each other, That's the problem with society. That's why, that's why there is burnout, there is stress, there is anxiety, and even अर्काले गरेर खाएको पनि देख्न नसक्ने भइएको छ, हो कि होइन? हो कि होइन? एउटा फोन, टेलिफोन, मोबाइल फोन बनाएको एउटा हुवावे भन्ने कम्पनीले एउटा विश्वको सबैभन्दा सम्भ्रान्त राष्ट्रले चाहिँ त्यसलाई देख्न सक्दैन। भन्नुको मतलब द्याट इज द वर्ल्ड वी आर लिभिङ एट। भन्नुको मतलब हामी के छौँ, त्यो केले भएको हो, त्यहाँभित्र बर्न आउट छ, स्ट्रेस छ, एङ्जाइटी छ, अर्को अन टपमा अर्को जान्छ कि भन्ने पिर छ हामीलाई, हो कि होइन? दिस इज द वर्ल्ड वी आर इन। तर के छ भने थाहा छ, वी हेभ फरगटन टु स्लो डाउन। हामी त सुस्ताउनु पनि पर्ने थियो, होइन? तर त्यो पार्ट छुटिरहेको छ, होइन? त्यसपछि गएर हामीलाई के हुनु थियो, हामीलाई त डिपली पनि थिङ्क गर्नु थियो, होइन? फास्ट थिङ्किङ गर्नु छ, होइन? तर डिपली थिङ्किङ गर्नु छैन। त्यसपछि गएर के हुन्छ, हामीलाई वाइजली थिङ्किङ गर्नु छैन। त्यस्तो भइरहेको छ आज, होइन? त्यसैले हामीले पिसफुल्ली लिभ नै गर्न सकेका छन्। हामी कन्सटेन्ट कन्ट्राडिक्सनमा छौँ, होइन? वारमा छौँ। त्यसैले के भने यहाँ चाहिँ के भने हामीले अर्को एरिया हेरी यसका मिसिङ पिसेस, हाम्रो वेलबिङभित्र, हाम्रो हेल्थभित्र, हाम्रो वेलबिङभित्र केही चिजहरू मिसिङ भइरहेका छन् भनेर यहाँ इम्फोसाइज गर्न खोजेको। त्यसैले के छ, यसमा के भयो भने हामीभित्र के छ, म छु। हामीले बाहिरपट्टिको जम्मै हेर्दा हामी हैरान भइसक्यौँ। तर किन मेरो छालाभित्र फेरि इन्टरनल पनि डाइमेन्सन छ, होइन? हाम्रो भित्र इन्टरनल र आउटर दुईवटा डाइमेन्सन छन्। हुन त मेरो फिजिकल हेल्थ पनि इन्टरनल नै हो, इन्टरनल डाइमेन्सनभित्र पर्छ। मेरो इकोनोमिक हेल्थ यस्तो बाहिर भए पनि, होइन? तर कस्तो भने त्यो बाहेक पनि, त्यो फिजिकल हेल्थ बाहेकको पनि डाइमेन्सन थियो, जसमा के छ, त्योभित्र मेन्टल डाइमेन्सन हुन्छ, होइन? मेन्टल भनेको यस्तो मेमोरी, कग्निसन, एकदम सार्प थिङ्किङ गर्ने, होइन? इन्टेलेक्चुअल एबिलिटी भने यस्तो भने। अनि त्यहाँबाट अर्को के हुन्छ भन्दाखेरि इमोसनल, होइन? त्योभित्र के छ, कस्तो फिलिङ आउँछ, होइन? म इन्टेलेक्चुअली त थिङ्क गर्छु, त्यसपछि फेरि मलाई त्यसले के फिलिङ ल्याउँछ कुनै चिजहरू हेर्दाखेरि, होइन? ती चिजहरूको डाइमेन्सन छ अर्को, होइन? फिलिङ एक्सपिरियन्सको, होइन? अनि अर्को चाहिँ के छ भने एउटा स्पिरिचुअल आध्यात्मिक भने भन्नुको मतलब के हुन्छ, अब मिनिङ के हो त, यो सबैको कुरा मिनिङ के हो, म र तपाईँको रिलेसनसिप के हो, हामी अलगै मानव हौँ, हामी कम्पिटिसन गर्नुपर्ने मान्छे हौँ कि एक अर्कालाई प्रेम गर्नुपर्ने मान्छे हौँ कि के हौँ, होइन? अथवा मेरो घरको वरिपरि वृक्षहरू छन्, होइन? तिनीहरूलाई मैले काट्नका लागि, घर बनाउनका लागि मात्रै भएका हुन्, या तिनीहरू पनि लिभिङ बिइङ हो, तिनीहरूसँग मेरो रिलेसनसिप अर्कै प्रकारको हुन्छ, यस्तो किसिमको, होइन? अब हामीले त्यो वनस्पतिलाई पनि देवता मान्थ्यौँ, होइन? वनस्पतिलाई देवता मान्थ्यौँ, होइन? अब सबै, होइन? पृथ्वीलाई, नदीलाई, सबैलाई गृह पनि देवता, होइन? गृह देवता, होइन? हामीले घरलाई पनि पुज्थ्यौँ, होइन? भन्नुको मतलब सरी, हामीले के भन्छ, त्योसित पनि हाम्रो के छ, स्पिरिचुअल रिलेसनसिप थियो, न फिजिकल, होइन? तर के थियो भने हामीले त्यस्तो होमसँग पनि स्पिरिचुअल रिलेसनसिप गर्ने सोसाइटीका हामी थियौँ, होइन? त्यस्तो ट्रेडिसन हामी आफैले देखेको। हामी सानै छँदाखेरि घरको पूजा आफैले गऱ्यौँ, अहिले पनि यसो उसका लागि कहिलेकाहीँ गर्नुपर्छ नि, टिका लगाइन्छ नि घरमा, होइन? भनेको त हामीले त्यस्तो सोसाइटी, त्यस्तो कल्चरबाट हामी उठेर अनि आज हामी कस्तो दौडमा हिँडिरहेका छौँ, होइन? अर्कै के हो दौडमा हिँडिरहेका छौँ। त्यसैले के छ भने यसैलाई, यो डाइमेन्सनलाई फेरि उजागर गर्ने, होइन? यसलाई उठाउने भनेर यस्तो यो कुरा गरिराखिएको छ। त्यसरी के छ भने यो वेलबिङ त आज विश्वभरि नै उठिरहेको छ। तर कस्तो भइरहेको छ भने हामीलाई के छ, हामी पुरै वेस्टको वे थियो, जुन थियो वेस्टर्न वे थियो, त्यसबाट हामी मूलतः दीक्षित शिक्षित छौँ आज होइन। त्यसैले के हुन्छ भन्दाखेरि हामीले के हुन्छ जस्तो वेस्टको हेरौँ मोडर्न साइन्स चाहिँ के छ आजको अहिलेको प्रेजेन्ट डे मोडर्न साइन्स इज डेभलप लार्जली कमिङ फ्रम वेस्टर्न माइन्डसेट है। त्यसमा के हुन्छ भन्दाखेरि यहाँ चाहिँ के थियो 2 मिलियन होइन मिलिनिया अब के थियो भन्दाखेरि मान्छेले के गरेको थियो ब्रेनलाई के गरेको थियो ब्रेन सर्किट्रीतिर थियो होइन। त्यसले चाहिँ के छ यो सिट अफ कम्प्लेक्स थट चाहिँ यहाँ छ होइन ब्रेनमा छ भन्ने कुरा मान्छेले आइडेन्टिफाई गरेको थियो उहिले आइडेन्टिफाई गरेको थियो। तर पछि आएर के हुन्छ हामीले नर्भस सिस्टमको डिस्कभरी हुन्छ होइन नर्भस सिस्टम आइडिया त्यसपछि न्युरोनहरूमा आयौँ 1960 आउँदा न्युरोनको डिस्कभरी भयो अनि आज चाहिँ न्युरो साइन्स भनिन्छ। अरे हामी के भन्छ यस्तो तरिकाले माथि उठिरहेका छौँ होइन। त्यहाँबाट हुँदा हुँदा के भयो अहिले पछि गएर के छ इन्टेलिजेन्समा त एकदम हामी फोकस छौँ नि होइन। हामीले जस्तै यहाँबाट विद्यार्थीहरू गयो भन्छौँ ती सबै आइक्यू टेस्ट गरेर लगिएको छ स्याट भनिन्छ यो भनिन्छ के हुन्छ हामीले के छ हामी ब्रेनका पछाडि छौँ होइन त्यसको पछाडि छौँ होइन। त्यसैले त्यो चाहिँ के भन्छ 1905 पछि आएर हामी यस्तो यो इन्टेलिजेन्सका पछाडि दौड्यौँ होइन। अनि त्यसपछि त्यहाँबाट मेन्टल इन्ड्युरेन्स सार्पनेसका पछाडि दौड्यौँ होइन। अनि त्यसपछि गएर के छ अहिले आएर 1990s पछि आएर के आइरहेको छ इमोसनल इन्टेलिजेन्सका यो अहिले भर्खर कोइन भइरहेको छ होइन। अहिले भर्खर यस्तो कुरा आइरहेको छ नि वेलबिङका कुरा गरिरहेको छ अहिले के भने हामी अर्कै इमोसनल वेलबिङ अर्कै प्लेनमा आज विश्व नै यस्तो आइरहेको छ। तर कस्तो भने यो चिज चाहिँ के थियो भने इन आवर ल्यान्ड इट वाज देयर लङ अगो है। मैले मिलिनिया अघि हामी त फ्रोजन इन टाइम होइन। हामी के छ नेपाल चाहिँ के छ टाइममा फ्रोजन छ किनभने हामीले कुनै रिसर्च डेभलप यस्तो किसिम गर्न सकेनौँ। हिजो हामी रिसर्च डेभलपमेन्टको देशमा थियौँ तर आज हामी त्यस्तो अवस्थामा छैन। हाम्रो बिजोग छ होइन हामीलाई हामी तर पनि के भने मैले यहाँभित्र भएको हाम्रो कल्चरले डेभलप गरेको केही चिज तपाईँहरूलाई देखाउन चाहन्छु। कस्तो हुन्छ भने हेर्नुहोस् है के हुन्छ हामीले चाहिँ के छ यो मानव होस् या यो ब्रह्माण्डको सारा चिज चाहिँ के छ प्रकृति र पुरुष मिलेर बनेको भनेर मानेका छौँ। प्रकृति पुरुषको मिलनबाट यो बन्छ भनेर मानेका छौँ। अनि कस्तो हुन्छ भने एउटा प्राकृतिक यो पनि अनादि हो भन्छ है दिस वाज एन्ड विल बी होइन। एन्ड देन देयर इज समथिङ कल पुरुष त्यो पनि अनादि हो भन्छ होइन। अनि दुइटै अनादि हुन् भन्छ होइन। अनि तर तिनीहरूको दुईवटा चाहिँ के छ भने तिनीहरूको कन्भर्जेन्सबाट यो सारा डाइनामिक चलिरहेको छ भनेको छ। त्यसमा जस्तै अब के हुन्छ हेर्नुहोस् है यहाँ के भन्छ प्रकृतिको डेफिनेसन छ होइन कार्य कारण कर्तृत्व प्रकृति हेतु रुच्यते अनि त्यसपछि पुरुष सुख दुःख नाम भोक्तृत्व हेतु उच्यते भन्छ होइन। त्यसमा यहाँ के छ भने मेरो धेरै मिनट छैन सरी है मैले कति मिनट बाँकी छ मेरो समय सकिसकेको छ। यस्तो चाहिँ के छ यसलाई पछि गरौँ के छ भने यो अब यो यस्तो नगरौँ मैले मिक्स अब यो कुनै बेला पछि डिस्कसनमा केही गरौँला है सरी। यस्तो चाहिँ के छ भने हामीले एउटा चाहिँ कस्तो भने मान्छेको सुख दुःख त्यो फिलिङको कुरा थियो नि होइन इमोसनको कुरा थियो एउटा त्यस्तो ओभरअल छ। हेर्नुहोस् है यहाँ भोक्ता मैले लाइक डिसलाइक गर्ने होइन सुख दुःखको एउटा त्यस्तो स्पेस छ यो भित्र होइन। अनि त्यसपछि गएर अर्को कस्तो छ फेरि हामीले जे कुरा गर्दा एउटा बिरुवा थियो त्यसमा फुल निस्कन्छ अनि फल निस्कन्छ त्यसलाई हुने त्यो कार्य थियो त्यसको कारण थियो होइन। त्यसपछि कोही सहीसँग त्यस्तो गर्ने कर्तृत्व भाव थियो होइन। त्यस्तो कारणले यो सारा विश्व ब्रह्माण्ड फक्रिरहेको छ भन्ने छ होइन। हामी ह्युमन पनि त्यस्तरी हामीभित्र यस्ता डोमेन छन् मेन्टल स्पेसभित्र पनि यस्ता दुईवटा डोमेन छन् भन्ने छ। अनि त्यसपछि गएर के हुन्छ भने हामीलाई यो त्यसैले के छ भने माइन्डको कुरा गरिएको छ नि माइन्डभित्र हेर्नुहोस् है माइन्ड भनेको अन्तःकरण होइन। अन्तःकरणका उसले के भन्छ अरे त्यहाँ चाहिँ के छ प्राकृतिक त्यसलाई चाहिँ प्राकृतिक हिसाबले हेर्ने हो भने त्यहाँ यतिवटा डोमेन छन्। के छ भने देयर इज अ सेटर छ मन भन्ने छ अहिले म धेरै जान्न कुनै चिजमा मेरो सेट हुन्छ होइन फोकस हुन्छ। त्यसपछि गएर के छ बुद्धि छ अथवा प्रोसेसिङ गर्ने थियो नि अघि त्यो इन्टेलिजेन्स कुरा गरिन्छ प्रोसेसर छ। अनि त्यसपछि चित्त भन्ने छ त्यहाँ लिमिटर छ। यो चित्त भन्ने अवधारणा आजकल मोडर्न टाइममा मिस भइरहेको छ हाम्रो उसमा छ। चित्त दुख्छ नि होइन चित्त बुझ्छ नि होइन त्यस्तो चिज होइन त्यस्तो चिज हुन्छ। अनि त्यसपछि अहङ्कार भनेको पोज्यासहरूका मेरो हो होइन यो मेरो यो तपाईँको भन्ने मेरो होइन भन्ने प्रकारको त्यस्तो केही छ। अनि त्यसपछि स्टोर गर्नु पऱ्यो नि होइन स्मृति भन्ने चिज छ होइन। त्यस्ता चिजहरू छ नि अन्तःकरणभित्र त्यस्ता हुन्छन् भने अनि फेरि के हुन्छ हाम्रो फेरि अर्को चिज छ त्यो पुरुष सरी त्यो पुरुष भनेको अघि देखाएको त्यो पुरुषभित्र के हुन्छ त्यसका फेरि अर्कै फ्याकल्टीहरू छन्। हेर्नुहोस् द्रष्टा अब्जर्भर छ होइन अब्जर्भर उपद्रष्टा भन्छ त्यहाँ अलि मैले त्यो द्रष्टा मात्र लेखेँ द्रष्टा अब्जर्भर हुन्छ अनि अनुमन्ता एनालाइजर हुन्छ भर्ता प्रोभाइडर भन्नुको मतलब मैले एउटा घरमा एउटा बिरालो आयो अस्ति एउटा सानो त्यहाँबाट त्यसले म्याउ म्याउ गऱ्यो अनि के छ मैले घरमा दुध थिएन कसै कहाँ गएर मागेर ल्याएर खुवाएँ किनभने त्यो प्रोभाइडर कहाँबाट आयो मेरो बच्चा नै होइन केही होइन तर पनि मलाई त्यस्तो हुन्छ नि होइन मैले भनेको उदाहरण दिएको हामी सबैलाई हुन्छ भनेको चाहिँ त्यस्तो भर्ता छ होइन। त्यसपछि अनि भोक्ता छ एकचोटि किनभने यो दुःख सुख फिल गरेर फिलर छ। अनि त्यो क्रिएटर छ हामीभित्र होइन यी चिजहरू चाहिँ के छ भने यो पुरै पार्टबाट डोमेन हुन्छ भनेर भनिएको छ होइन। त्यसैले कस्तो भने हामीभित्र के थियो भने देयर वाज ए भास्ट फिलोसफी अफ लाइफ द्याट इज हिडन हियर इन आवर लिट्रेचर्स इन आवर कल्चर इट इज इम्बेडेड होइन। त्यो अहिले मैले भने त्यो जुन घरलाई देवता मानेको त यहाँ अझै छ नि होइन, इट इज नट लस्ट भन्नाले त्यसको मिनिङ लस भयो होला तर कल्चर त त्यहाँ बाँकी छ नि। त्यसैले के छ भने वी आर इन अ ल्यान्ड होइन, यो ल्यान्ड अफ युनिक आइडेन्टिटी यो ग्लोबभित्र यो स्पेसमा आज विश्व जहाँ जाँदैछ खोज्दैछ त्यसमा हामीभित्र एउटा कुनै गजब चिज लुकिरहेको छ। त्यसैले मलाई के छ यो देवभूमि हो, तपोभूमि हो, यो वेदभूमि हो होइन। त्यसैले के हुन्छ भन्दाखेरि यहाँ चाहिँ यो त ड्रिमल्यान्ड अफ पिलग्रिम्स थियो, तर भोलिका पिलग्रिम्सहरूको ड्रिमल्यान्ड फेरि हुनसक्छ यो नेपाल हिमालय के हुनसक्छ, इट विल इज अ ड्रिमल्यान्ड होइन, इट विल बी अ ड्रिमल्यान्ड आउँछ अगेन इफ वी वेक अप होइन। त्यस्तो तरिकाले मैले तपाईँहरूलाई गरेको। त्यसैले यो ठाउँ कस्तो यसका धेरै प्र्याक्टिसहरूका रुटहरू छन्, योगा साङ्ख्यको यो साङ्ख्यको ठाउँ हो। यस्तै गरेर के हुन्छ यस्ता यस्ता चिजहरू चाहिँ छन्। त्यसैले के भने एउटा त्यस्तो किसिमको त्यही स्पिरिटमा एउटा कस्तो भने हामीले खेती पनि के छ भने हिजो अघि भर्खरै कहाँ एउटा ऋषि कृषिको कुरा गर्नुभएको थियो भने त्यस्तो किसिमको के छ भने हामीले के छ खेती गर्ने भनेको छ खालि के छ धेरै उत्पादन गर्ने के गर्ने भनेको छ नि, त्यस्तो नभएर के हुन्छ हामी कसरी हिजो ऋषिमुनिहरू यहाँ तपस्या गर्न आउँदाखेरि कमण्डलु मात्रै लिएर जसरी आएर पुग्थ्यो त्यसरी नै भोलि कसरी त्यसलाई ल्याएर स्कलरहरू आउन सक्छन्। स्कलर दुई किसिमको हुन्छ, एउटा पैसाको लागि दौडने महिना महिना तलब बुझ्ने, अर्का चाहिँ यो महिना महिना तलब बुझ्नुबाट दिक्क हुने म जस्ता हुन्छ त्यसरी छोडिदिन्छन् जम्मै कुरा होइन। तर त्यस्ता मान्छे त कहीँ हुन सक्छन् तर जीविकाको प्रबन्ध छैन होइन, तिनीहरूले फ्रीली स्कलरसिप गर्न सक्दैनन्। अनि कुनै चाहिँ के छ हाई ल्याबोरेटरीमा होइन बिलियन्स अफ डलरको ल्याबोरेटरी चाहिने हुन्छन् भने कुनै चाहिँ मात्र माइन्ड चाहिने हुन्छन्। त्यस्ता एरियाहरू जुन चाहिँ लो कस्टमा गर्न सकिने चिजहरूमा हामीले कसरी यो ल्यान्डलाई कसरी त्यो गर्न सक्छौँ भनेर हामीले हेर्नका लागि यस्तो किसिमको एरियामा काम गरेका छौँ। कुनै बिल्डिङहरू बनाउने यस्तो किसिमको केही ल्यान्डहरू किनेर एउटा सानोतिनो फिलिङको चाहिँ गर्नका लागि केही काम हामीले इनिसिएट गरिसकेको छ। मैले एक्लै आफ्नो पर्सनलिटीसँग यस्ता कामहरू मैले गर्न थालेको हो होइन। त्यसपछि गएर यो फिजिकल इमोसनल फ्युजनमा गर्न खोजेको होइन यो डेभलपमेन्ट। त्यहाँबाट अनि के हुन्छ भन्दाखेरि अब त्यस्तो काममा यहाँ लागिराखिएको छ भनेको त यहाँभित्र के छ यो प्रकृतिलाई के छ प्रकृति कुनै चिज फ्याँक्ने होइन होइन मैले सक्छु त्यसरी त्यो मोडमा हामीले केही गर्नु।
Please kindly conclude. We are going over the time.
त्यसैले लास्टमा गरेको छ त्यस्तो एरियामा हामी होइन हामी सबैले कन्ट्रिब्युट गर्न सक्यो भने वी विल बी समवेयर। आई एम रियली सरी। थ्याङ्क यू थ्याङ्क यू थ्याङ्क यू।
Dr. Pramod Dakal for the wonderful presentation. Now I would like to invite the recorded presentation of Dr. Bezer Jivudi. His presentation is also on Emotional Wellbeing Institute and its global initiatives. Yeah, so I would like to invite Dr. Bezer Jivudi to present his and share his remarks and present the presentation.
Professor Jiawadi, I would like to ask, would you present live or shall we use recorded presentation?
Well, I can present live.
Great, great. That would be better. Thank you, thank you, thank you. वहाँको स्लाइडलाई राख्दिउँ है, स्लाइड निकाल्दिउँ, स्लाइड पठाउनु भएको छ। उहाँको स्लाइड यहाँ छ, डाक्टर बसिर जिवाडीको स्लाइड।
Okay, slide number 1, please, here. Greetings from Mauritius. I'm Professor Basir Jiawadi. I don't speak Nepalese, but I could understand some of the words from the presenters because I speak a bit of a Hindi. So some of the words are very similar to Hindi. I speak French. I speak fluent French. I won't present my presentation in French. It has to be in English. So thank you very much. It's lovely to see you all. I'm sorry I won't be there in person, but hopefully next time at the next Global Knowledge Convention, I will be there. I can see one or two persons I know in the audience. For example, Dr. Chintamani Yogiji. I know my friend, my good friend, Professor Raju Adhikari, and thank you very much, Dr. Pramod, for helping me with this particular slide. Well, my topic is Emotional Wellbeing Institute, its global initiatives. Well, it's very difficult to present everything and anything within 15 minutes. I try to run through some of the key points. And can I have slide number 2, please? Thank you. You might ask me to start off with how did I get interested in emotional well-being? Well, I have got a fairly pluralistic background. I have got a very pluralistic background. I have got a doctorate in mental health. I'm also a psychologist. I've got education background, like master's in education, and I have been very engaged in community work, for example, indigenous social emotional well-being, international work. I have been the dean for international program and so on and so forth. Over the years, I got very interested in the whole notion of emotional well-being. What I have found that emotional well-being has not really shifted, has not really advanced. Now, when I heard at least three of the speakers this morning, all the three speakers talked about mental health issues, depression, suicide, and so on. It's constantly increasing, and I'm very, very critical about it.
Jivudi for the wonderful presentation. So today in the room with us is an internationally acclaimed expert on health and well-being. He is no other than Dr. Kingsley Brooke. It is an honor and delight for us to have Dr. Brooke with us. I'll now invite him to say a few words.
Namaste, everyone. Nice to be here with you all. I don't know if we can put my first slide on? While we're waiting, I'll start. Nepal is a very unique country, and yet it has huge potential, and it's not being utilized. We need to utilize Nepal's potential. And it has in its potential as the home of Vedic wisdom, Vedic knowledge. Maharshi Mahesh Yogi revived the ancient Vedic knowledge, but he did it in the scientific language of our time. This is a key thing because the language of today is the language of science. People do not believe something that is just a philosophy or some new religion or some talking about the reality of life. We all here in Nepal understand that, oh, here we go. Okay, so the goal really of what we're talking about here is to restore Vedic science in the light of modern science. Knowledge and technology for the practical benefits of all areas of society. Next slide. First, this is a picture of our campus here in Kathmandu, the Brahmananda Saraswati Nagar campus. It was named after His Holiness Maharshi Mahesh Yogi's teacher, who is the Shankacharya of Jyotir Math. And this is a place where we are doing training for Vedic scholars, as well as holding courses for advanced training for all the Nepali population. Can we have the next slide? The first area that is so critical to develop is the area of education. Education, as we know it today, is really information-based. It's like, you got to learn this, and you have to regurgitate it back to your teacher, and then you pass. You get it, you have a test, and you pass. Maharshi brought out Vedic education, which is consciousness-based education, to develop the full potential of the knower. We know that there are different processes of how to gain knowledge. There's the knower, the process of knowing, and the known. Modern education, as we know it today, is just focused on the known, gathering information. Consciousness-based education develops the knower, develops the container of knowledge. If we don't develop the container of the knowledge, education is stressful. Education is ineffective. In fact, the stress of education actually shuts down the development of the knower, shuts down the development of consciousness, the expansion of consciousness. And so Maharshi introduced a simple educational technology called transcendental meditation. Can we go to the next slide? I don't know how to, yes. Called transcendental meditation that allows every student to experience the field of consciousness, pure consciousness that is within every individual. And by developing this, the whole experience of knowledge becomes easy because it is a container of knowledge. We experience through consciousness. We experience by the level of consciousness that we have developed as an individual. So consciousness-based education focuses on developing the consciousness of the individual. We see all of modern science is going more and more towards a more abstract field of life. You see on the left side here, the development of modern physics, going to quieter and quieter levels of creation, more subtle levels of creation, and now modern science has glimpsed the unified field of all the laws of nature deep within nature. But that same deep within nature is deep within our own consciousness. The field of consciousness is within us all, and it is a home of all the laws of nature. And we can experience that through an effortless technology called transcendental meditation, which could go to the previous slide. We can see the active level of the mind, the quieter levels of the mind, and experiencing the source of thought, where all thoughts come from, all creativity. So what we're doing in consciousness-based education is developing the home of all knowledge. Because as we expand consciousness, we're expanding the ability to access the field of total knowledge, all knowledge. If we think about it, everything you can search on in Google, everything you can find in any book, in any library in the world, where does it come from? It comes from the thought of some man, some woman. And where is that thought coming from? It's coming from the field of consciousness that underlies the whole creation and is within every individual. That is the field of consciousness. And if we can develop that in our students, we're developing their full potential. They're becoming more creative. They're becoming more intelligent. Research on transcendental meditation is shown over and over again. It develops the intelligence of the student. Go to the next slide. We can see this in the ancient Vedic literature. These are two very important quotes from the Bhagavad Gita. Nistroy guno bhavajun. Be without the three gunas. The gunas are the field of activity. So Krishna's dictate to Arjuna was be without the three gunas. Go beyond the field of thought, the field of action, the field of diversity. Go to the field of consciousness within. Yogastha kuru karmani. Established in that field of life, then come out and perform action, and then all of your activities are more effective. It's like skill in action. And this Yogastha kuru karmani is the description of transcendental meditation. It is go beyond to the field of transcendental consciousness and then come out and act. And you'll be more effective and more fulfilled your desires. Skill in action is skill in more powerful thinking. If you want to hit the target with an arrow, you can try throwing it like this. It's very ineffective. But if you pull it back on the bow and let it fly, it hits the target. Take the mind deep within. Yogastha kuru karmani. Come out and perform action, and you fulfill those actions very spontaneously. Next slide. This is, we do regular training with some of our scientists from Maharishi International University. This is Dr. Ashley Jeans, training our teachers on how to implement consciousness-based education, this technology of education in the schools of Nepal. Next slide. Next slide. Now the field of health. Now we know that 80% of disease today are psychosomatic diseases, stress-induced diseases. Now, when the mind is drawn within through this practice, this effortless practice of transcendental meditation, the mind settles down, the body settles down. The body gains a state of deep relaxation, deeper than even the deepest point of sleep. And in this state, the body has a chance to rejuvenate itself. So a fundamental of health is having this experience of the inner value of life, taking the attention to this field of transcendental consciousness. And each person can have this experience. They are creating prevention-oriented health in their own life. What we have today in society is a disease care system. You get sick, you go to the doctor, and they give you something to try to make you feel better. And this is extremely expensive, for one thing. And if we implement this prevention-oriented healthcare, where you can actually strengthen the nervous system, strengthen the mind, so that it is more resistant to disease, less people fall sick, and therefore you spend less on healthcare. Next slide. We have hosted here the International Ayurveda Congress. From people from all over the world came, and it was inaugurated by the Prime Minister of Nepal. We signed an agreement with some of the universities here in Nepal to implement Ayurveda, the ancient Vedic knowledge of prevention-oriented healthcare. This is a jewel of Nepal that you're not fully utilizing. You're being influenced by Western scientists who come in and say, take my drug, buy my drug, and it'll give you a quick fix. But it's like almost becoming a drug addict by going that way. We can become strong by fully implementing this Ayurvedic medicine, Ayurvedic knowledge of Ayurveda, so we may become a more strong society or invincible society by developing this field of knowledge. These are some of the leading experts of Ayurveda from India and from Nepal and all around the world. Go to the next slide. This is a picture of it. It was at this same hotel. Next slide. Here we are. Dr. John Hagelin, the president of Maharishi International University, is presenting his book, A Manual for Perfect Government, and also Veda in the Human Physiology, Dr. Tony Nader's groundbreaking work that shows that where is the Veda? The Veda is not in the book. Veda is in consciousness. It's in the whole human physiology, which is the hardware that can run the intelligence of the whole universe. Veda is like the blueprint of the universe. It's the structuring intelligence of all natural law, of all life. And it is within our own human physiology, and it can be experienced through these effortless practices. Next slide. Agriculture. This is another great resource that that Nepal has. 80% of the economy of Nepal is agriculture, but we should be utilizing organic agriculture, but not just organic agriculture, but Vedic organic agriculture. The knowledge of how to infuse more nutritional value into the food that we eat. Food is like medicine. If we have good organic food, Vedic organic food, we will create healthy individuals just from the food that they eat, much less the great knowledge of all of the Ayurvedic medicines and herbal medicines that are available as well. And this is the knowledge that one of the areas that Maharishi brought out is the knowledge of how to use the Vedic recitations to improve the quality of the food. Next slide. Next slide. Next slide. You can see here that the Vedic yagya is performed during the different stages of the growth of the plant to infuse additional quality into the quality of the food. So we're now training all of providing training to people in Vedic organic agriculture. This is another area of knowledge that has come out with the revival of this ancient Vedic knowledge in the scientific language of our time. Next slide. This is just a picture of the Vedic yagyas being done at our campus, just near in Dakshinkali, very nearby. Next, we can go through these quickly. This is it. Okay, also another field in which Vedic knowledge is being brought out is the field of architecture, Vedic architecture, Sthapatya Ved, Vastu Vidya. We just completed just a week ago, international course on training international architects in Vastu Vidya. Next slide. And what this knowledge of Vedic architecture, this is a picture of the course of the graduates from all over, from about 15 countries around the world. The buildings that we live in, the cities that we live in, create the quality of life that we live. We need to live in houses that connect our individual life with cosmic life, the structuring intelligence of nature. And this is what the ancient Vedic Vastu Vidya is. It shows you how to build a house so that you are established on this earth in a proper way. You can go into great details in just one field, but this is just a picture of that recently completed course. We had press conference announcing this to all of the press. Next.
May you conclude in a minute so that we can allow questions?
Yes, I'm almost done. This is showing some of the examples of Vastu architecture that have been built. This is the Jyotishmati Vidyapith School in the western part of Nepal. Next slide. Next slide. We can go quickly. This is a school. This is our headquarters. The headquarters where we have our Maharshi Vastu Bhavan built according to Maharshi Vastu. Next slide. This is the whole campus that we are now functioning from in Dakshinkali, near Champadevi. You can go quickly just to get a flavor of everything. It's a beautiful city. We're building another Vastu campus in the eastern part of Nepal, in Chapa, which is a very hotbed of Vedic knowledge, and we want to give the opportunity for bringing out again, not rewriting, but bringing out the ancient Vedic knowledge in the scientific language of our time. We're also building a Vyas retreat, Maharshi Ayurveda Health Center in Pokhara, where we can introduce all of the ancient technologies of health to anyone from all around the world. This will be an international center for Ayurveda, and here you can see it under construction. We have a whole Gurukul program, Vedic education program throughout Nepal with over 88 schools with about 4,000 students or more. And they connect up every morning to, you can keep going through these slides. These are showing all of the school Gurukuls all around Nepal. And we connect up every morning. This is some of the just pictures. Next slide. This we connect on Zoom technology so that we can perform the peace yagya that's done for the whole world throughout the whole of the Gurukuls around Nepal. There's about 1,331 pundits every day. They're connected via Zoom doing this Rudravishek yagya. This is Bindavasini temple in Pokhara. This is Buddha Nilakantak. Next. This is in Pokhara. Next. So we also have many of these senior pundits, Nepal Maharshi Vedic pundits, that are performing personal yagyas for people all around the world. Next slide. We can go and this is just a quote from the Vedic literature that emphasizes this understanding that consciousness is the home of Veda, really. Riksho akshare parme vyoman yasmin deva adi vishve nishedu. The verses of the Veda exist in the field of consciousness, parme vyoman. They're not in the books, they're in the field of consciousness. They're the impulses of intelligence that structure the whole universe. And if we can experience that twice a day through regular practice of this TM technique, Bhavati Dhyan, we are growing in the field of consciousness every day. We're more expanded in our vision of the world. We can unfold creative ideas to change the world that can really think. Because the field of consciousness, as I've emphasized, is the field of all possibilities. Everything comes from consciousness. So we have access to the treasury, the field of all possibilities, to solve any of the problems that are there in the world. If we're unfolding that field. Keep going. Again, showing how our yagyas that we perform through Maharshi yagyas are performed from the para level. We know that there are different levels of the mind. There's the surface level, the Baikri level, Madhyama level, the thinking level, Pashanti, the level of feeling, and then there's the para level, the transcendental level. When we perform yagya from that level of para, because our pundits are transcending, the power of the yagya fulfills its purpose. Many people are rejecting these yagyas and rituals of Nepal because they've lost their effectiveness, because the pundits weren't transcending, performing the yagya from the transcendental field of life. Next slide. Some of our pundits in front of Pashupatinath. Next slide. Again, our campus. Next slide. This performance of Yagya. Just go. You can click right through these. This is in the eastern part where we have more campuses coming up. And this is in Bhumai, another campus in central Nepal. Some of our pundits there. And this is just how we can apply this knowledge. I won't go, you get the idea that every field of administration and government, we can apply this knowledge, this ancient Vedic knowledge of consciousness. Because consciousness is a field, and if we can enliven that field of peace and harmony within individuals and collectively, we can do it for the whole world. And this is why Nepal, Maharshi said when he visited here in 1974, Nepal to lead the world. It was the birthright of Nepal to have this knowledge, but to bring it out now in the scientific language of our time. And this is the charge to every Nepali, not just Nepalis here, but Nepalis all over the world, who are the custodians of this knowledge. Chintamani ji likes to say, if you want to save the world, you need to save the Veda. If you want to save the Veda, we need to save Nepal. Nepal needs to rise to its rightful place in the world as a leader of the world, to lead the world, because it is the home of Veda. And that's this knowledge of Veda brought out in the scientific language of our time can transform the earth to heaven on earth. Ram Raj. Next slide. Next slide. Yeah, I just wanted to end. Oh, we are a place of many cultures, and we know that the Vasudev Kutumbakam is the great saying of the Vedic literature, that every religion, every culture is part of our world family. Next slide. Vasudev Kutumbakam, the world is my family. So thank you very much for allowing me. Sorry I went on a little bit. I didn't realize what all the time constraints I had, but I enjoyed very much talking to you all.
Thank you so much, Dr. Kingsley Brooks, for the wonderful presentation. So now we will be heading to question and answer session. So I would kindly request you to ask questions.
Very quick questions. You said Nepal is the center of Vedic knowledge. Can Nepal utilize it in terms of economic development through that knowledge, or just it's that knowledge only? Number one question. And number two question, you're talking about the Vedic architecture, Vedic this engineering, but in the picture it depicted the modern construction material. So how did it match? Two questions.
First, your question was economic development through Vedic knowledge. When you really understand that consciousness is all there is, economic development comes from the creativity of the people. And where is the source of creativity? It's within. When you have the most powerful technology to develop creativity, to develop the field of all possibilities, think about that. Consciousness, reverberating, is the structure of everything in the universe. Everything that exists and will exist and did exist, it's Smriti Puran, ancient and eternal knowledge that is all there. When we fully access that, when our nervous system is fully pure, relieved of stress and strain, we have the field of all possibilities at our thing, and economic development can become a snap. Because economic development is just a reflection of the collective consciousness of the people. And if you fully develop the collective consciousness of the people, prosperity will go. Just as an example, Nepal has the greatest natural resources of almost any country in the world, from the high Himalayas down to the plains. Why aren't you the most rich country in the world? Lack of development of consciousness of the people. And you are the owners of this knowledge on how to develop the full potential of the individual. So there's no reason why Nepal should not lead the world, not just spiritually, but materially. Maharshi said 200% of life is the natural state of life, 100% material wealth and affluence, but balanced with 100% spiritual development. And that's what Nepal can do, and that's why Nepal will lead the world. Second point was,
Why this modern construction material is being used there?
yes,
As you're
yeah,
talking about
yes.
He's talking about a steel and then let us say
Yeah, yeah,
or
yeah.
lead paints and all that. Why that is a yeah.
Vastu Vidya it is in favor of more natural materials. But the most significant element to Vastu Vidya is the implementation of the proper proportions, orientation, and structure of the physical structure and its orientation to the sun, to the moon, and to the planets. That's where the biggest benefit comes. Those are important, what you said. We should be using natural materials and everything, but it's a little bit secondary to the most important thing. I hope
Thank
that
you,
was clear.
Dr. Kingsley Brooks. So yeah, due to the timing, I would like to request if you have any questions or queries to discuss on during lunch. So now I would like to invite the co-chair of Health Symposium, Dr. Avinav Vaidya, for the closing and to provide vote of thanks.
Thank you very much, everyone, for wonderful, insightful talks. Some research into what we see outside and some research into what we have inside the mind. I think let this session not be an end product of this, but be an opening and a starting point of things to follow. So I really look forward to the NRN community to take this forward in more than one ways. Let this be a harbinger of the things to come, both intelligently and intellectually and in insights as well. With that, I want to thank all the speakers. Sorry that we couldn't accommodate one speaker, Kripa Dahal, but we had very good 1.5 hours, and I think we are going back a lot richer in terms of, let's say, our, not only in terms of knowledge, but I think we are taking back a lot of things to think about and to reflect upon in our daily lives as well. I'd like to acknowledge the presence of Dr. Anuj Kandel, who is one of the key persons in the NRN and community. So with that, I thank you once again for your presence. Thank you very much.
Thank you so much, Dr. Avinav Vaidya. Now is the session of Token of Love, and for that, I would like to invite the chairperson of the symposium, Raju Adhikari, sir.
Thank you. Before I go to my session, I'd like to, on behalf of the convention chair, I'd like to thank all the excellent speakers. It's an enlightening, very meaningful, very informative, and a very high level of information. As a scientist in the biomedical field for the last 30 years, and with my Vedics background, I can understand that how we are talking now at the subconscious, conscious level, bringing those connectivity between spirituality and modern knowledge. I think it's absolutely necessary to understand, considering the research in the medical field, especially in neurons and in brain part, is very poorly understood. We are just understanding it. And on the other hand, the heart, there's no research, it's all emotions. So I think COVID has brought a lot of understanding of the mental health, which we were neglecting for so long. We were so after physical well-being. The emotional well-being was only surfaced after the COVID. And it's one of our greatest moral challenge of the world. It's going to cost trillions of dollars. And the solution, in every 10 billion of our population in 2050, if you look at their ECG or mapping of their heart or this thing, each individual have a different emotion, a different age, collectively, socially, community, as a nation, everyone is suffering. So this session, I think, would work towards achieving those solutions. And it's as a institute, emotional well-being, my boss, Professor Jia Wodi, he is in Geneva. I've been the appointed deputy chair of this. It's a great understanding, and it has given me a leverage to connect to King's, Maharishi universities, and many other scholarly network globally. So we're working and looking for consortium partners to work in the field of emotional well-being. And HICAST, Kathmandu University, who is already doing some initiative in this field, we're working together to start a professional doctorate program, the first emotional well-being doctorate program, and the first international journals on emotional well-being that will be published online from next year on. So we're working with partners like Mercy, and thank you for being with us at a very short notice. We are apologetic. We couldn't give you every speaker much of the time as expected. But once again, on behalf of the convention, I would like to thank you, every one of you. We have a formalities I have to do as a chair. We have to give token of appreciation. For all the speakers, we have the certificates, which will be sent to you by PDF, signed copies by our president and a few other to send to you. So you will receive a copy of your certificates of your contribution. But for the chairs, we have decided to give away token of appreciation. So I'd like to invite the 3 chairs who conducted this session most beautifully and very intelligently and such a complex topic. Sanjeev ji, are you there at the online? We can give you virtually. Otherwise,
Yes, I'm here.
I'd like to invite you.
Yes, I'm here. Yes, 2 a.m. in the morning. I watched thoroughly a very productive and useful session. Thank you very much. All the speakers, all the attendants and audience, and the moderator, and everyone for the wonderful session. Thank you.
Can you see your token of appreciation?
I can see that, Dr. Raju. Thank you.
Thank you.
Thank you very much.
Thank you, and we'll send you virtually.
Thank you much. Thank you.
And we'll send you to America.
Okay.
And Doctor, please. Another one. Dr. Pramod Dhakalji is my colleague and friend, a family friend, and an excellent scholar. It's good to thanks for sharing the session. Thank you. Dr. Abhinayji.
Thanks so much.
Yeah. Thank you. Thank you. And we'd like to give away one of our special guests, Dr. Kingsley from Mahasi University, this token of appreciation as a memory for you. And hope this will start our partnership going forward into the future. And as Pramodji mentioned, Nepal is going to be the spiritual hub of emotional well-being and a Kathmandu University doctorate program. And you will be one of our mentors and supervisor and a partner. Thank you very much.
Emotional well-being is spiritual well-being.
Yeah, thank you. With that note, I have the privilege and honor to close this session. Once again, thank you. And we'll have a group photographs. Please come over to the center stage and we'll take a group photograph. Thank you.
We are starting this session number 7, day 2. The topic is disruptive digital and AI technology. Welcome to this session. We have 2 sessions here. First, we have 3 speakers, keynote speaker, and two more expert speakers. And then we have a panel discussion, both comprising of 90 minutes, 45 minutes each. Each speaker will be having 10 minutes with 5 minutes question and answer. And the next 45 minutes is for the panel discussion. And along with this, we also have a poster paper on development of tiredness and drowsiness judgment system based on eye and facial features detection. So anybody interested can get a briefing on that too, which is placed outside in this hall. Moving on, this is a very important topic, digital transformation, this disruptive digital and AI technology, and it is chaired by me, Pratima Pradhan. I'm from Kathmandu Engineering College, and we have the steering committee chair, Dr. Gyanendra Prasad Joshi. He's in South Korea, and he is online right now. And we also are supported and driven by Dr. Yagiraj Pandey from Kathmandu University, who is in the AI division himself. So moving on, our first speaker is a keynote speech from Dr. Birender Mishra. He is a brief biodata on him. He's an MSc in IT, honorable doctorate in IT. He has 32 years of work experience in government in Nepal. He's a former joint secretary of Ministry of Communication and Information Technology, Director General of DOT, Controller OCC, IT Director, Inland Revenue Department, IT Officer, FCGO, and PSC. Additional high-level responsibilities he has taken up, being a chairman of Nepal IGF, Internet Governance Forum, since 2017, being a board member of Nepal Television and National Information Technology, co-chair of ICT Development Committee and FNCCI. He's advisor also to the CAN. He has had lots of level awards, national level awards, Outstanding Civil Award, and Suprabal Jan Seva Padak also. So he has been involved in his long tenure in the policy making, act, rules, and drafting. So I give the mic floor to him for his topic, Digital Transformation in Nepal, Pioneering a Path to Prosperity. Thank you, sir.
Of this session, Dr. Pratima ji, उपस्थित panelist, chairperson and NRNA का केही सदस्यहरू, विशिष्ट व्यक्तित्वहरू, नमस्कार। सर्वप्रथम त म यसमा सर्वप्रथम NRNA लाई कृतज्ञता ज्ञापन गर्न चाहन्छु। मलाई आज यस्तो कीनोट स्पिकरको रूपमा डिजिटल ट्रान्सफर्मेसन इन नेपाल द पायोनियरिङ पाथ टु प्रस्पेरिटी सब्जेक्टमा आफ्नो कीनोट स्पिच दिनको लागि मौका प्रदान गर्नुभएको छ। अनलकिङ अपर्च्युनिटी इन डिजिटल वास्तवमा कस्तो छ, जुनसुकै क्षेत्र होस्, शिक्षा होस्, स्वास्थ्य होस्, कृषि होस्, कोही व्यवसाय होस् अथवा गुड गभर्नेन्स होस्, जुनसुकै क्षेत्रको जुन अपर्च्युनिटी छ त्यसलाई यो क्याटालिस्टको रूपमा डिजिटल काम गर्ने हो। अब क्याटालिस्टको रूपमा काम गर्ने एउटा म सिम्पल एक्जाम्पल दिन चाहन्छु यसमा। जसरी एउटा टिचरले एउटा कोठामा बसेर एउटै टाइममा कतिजना विद्यार्थीलाई पढाउन सक्छ सेम टाइममा? 10, 20, 40, 50, 100 त्योभन्दा बढी त सम्भव हुन्न। तर त्यही टिचरले त्यतिकै टाइममा यदि डिजिटल प्रविधि युज गर्यो र सिकाइका तरिका फरक भयो भने के हुन्छ त, उसले हजारौं लाखौं मान्छेलाई त्यसै अवधिमा त्यही एउटा टिचरले त्यो शिक्षा प्रदान गर्न सक्छ। त्यो के भयो त, रूपान्तरण भयो। रूपान्तरण सिकाइको रूपान्तरण, सिक्ने तरिकाको रूपान्तरण भयो, ट्रान्सफर्मेसन। र अर्को के छ त्यसमा डिजिटल प्रविधि प्रयोग भएको। अब यस सम्बन्धमा मैले अब राइटै हो यसमा मेन टपिक मैले के राख्न खोजेको हो भन्ने डिजिटल ट्रान्सफर्मेसनको नेपाल ग्रोथ र प्रोस्पेरिटीको लागि के को रेलिभेन्सी छ त्यसको बारेमा पहिला म प्रस्तुत गर्नेछु। त्यस्तै नेपाल सरकार र निजी क्षेत्रले के डिजिटल इनिसिएटिभ्स यो सन्दर्भमा डिजिटल ट्रान्सफर्मेसनको कन्टेक्स्टमा लिएको छ त्यसको बारेमा म केही कुरा यहाँ राख्न गइरहेको छु। अब यहाँ अनलाइन युपिएस छैन यसको अर्थ हो ए हुन्छ। अब डिजिटल नेपाल मा अर्को भनौँ नि अब जस्तै गभर्मेन्टले डिजिटल नेपाल फ्रेमवर्क ल्यायो, आइसिटी पोलिसी ल्यायो। डिजिटल नेपाल फ्रेमवर्कमा यहाँहरूले अब के भन्छ 1880 भन्छ 1880 भन्छ। 1 भनेको नेसन, 8 भनेको सेक्टर भयो पोटेन्सियल सेक्टर, 80 भनेको त्यो इनिसिएटिभ्स पहलहरू छन्। अब त्यसको चाहिँ बारेमा नेपाल सरकारले ल्यायो। त्यस्तै आइसिटी पोलिसीमा अहिले कम्युनिकेसन र आइटी दुईटैलाई समावेश गरेको छ। तर चाहिँ डिजिटल के भयो आएन त आयो हामी त्यो डिजिटल ट्रान्सफर्मेसनको अरू क्षेत्रमा पनि कुरा गर्न सक्छौँ। जसरी अब स्वास्थ्यको अब ठिकै छ, अब यसैबाट आउँ हैन। अब सोसियो इकोनोमिकको डिजिटल सोसियो कम्पोनेन्ट्स के छ त्यसको बारेमा प्रस्तुत गर्नेछौँ। त्यस्तै डिजिटल इकोनोमीको पिलर के छ, यसको स्टेटस के छ, इन्टरनेट पेनिट्रेसनको अवस्था कस्तो छ नेपालमा अहिले, युथ वर्क फोर्स यो चाहिँ यो युवा शक्ति भनेको एउटा ठुलो पोटेन्सियल देखिएको छ। त्यस कारणले यसको बारेमा मैले राखेको छु यसमा। र अब इन्भेस्टमेन्ट र कोलाबोरेसनको लागि फ्युचर आउटलुक र अपर्च्युनिटी के छ, जस्तै पोटेन्सियल सेक्टर एन्ड कम्प्युटेबल बिजनेस। अब हरेक सेक्टरको के कम्प्युटेबल बिजनेस हुनसक्छ, त्यस्तै यसलाई इनेबलिङ इन्भाइरोमेन्ट के हुनसक्छ, यसको बारेमा म प्रस्तुत गर्नेछु। अब रेलिभेन्सीमा के राखियो त पहिलो टपिक जसरी भन्नु अब एग्रिकल्चरको कुरा गर्ने हो भने यो मैले न्युज पढेको त्यसमा चाहिँ 33.6 अर्बको चामल मात्रै आयात हुन्छ हामी कहाँ। अरूको त कुरै छोडिदिउँ, चामलको कुरो छ, चामलमै हामी आत्मनिर्भर छैनौँ। अब त्यसो भए के भयो त, अब एसडिजिजको कुरा गर्ने हो, सस्टेनेबल डेभलपमेन्ट गोल्सको के भन्छ, नो पोभर्टी, जिरो हङ्गर। अब हामी त कहाँ छौँ, चामलै हामीसँग छैन, रेमिटेन्सको पैसाबाट किनेको हो हैन। अब यो चाहिँ यसलाई हामीले च्यालेन्जको रूपमा लिएको, कसरी यसलाई इम्प्रुभ गर्ने। त्यस्तै युनिभर्सल एक्सेस टु हेल्थ जुन लास्ट सिजन, यो चाहिँ सबैसँग स्वास्थ्यको गुणस्तरीय स्वास्थ्यको अझ सेवा पुगेको छैन। त्यस्तै अब शिक्षाको कुरा गर्ने हो भने 100% हाम्रो शिक्षा त छैन। त्यसै कारण एजुकेसन टु अल। टुरिज्मलाई अब एउटा ठुलो नेपालको भनौँ नि जहिले पनि के भनिन्छ, हाइड्रो पावर, टुरिज्म, आइटीको त नामै छैन, तर टुरिज्मलाई छ। यसले डिजिटल इकोनोमीमा यसले सपोर्ट गर्छ। अब टुरिज्मको अवस्था के छ, झन्डै 30 लाख 32 लाखको हाम्रो क्यापेसिटी छ। अकुपेन्सी कति छ, 6 लाख छ, भन्नाले 20% लास्ट इयरको अकुपेन्सी छ। अब यसलाई कसरी प्रमोट गर्ने, यसलाई यही डिजिटलको कुरा आयो। फेरि फिनान्सियल सबैको सहभागिता चाहियो, वित्तीय सहभागिता, यसलाई हामीले राख्यौँ रेलिभेन्सी। त्यस्तै लोकल बिजनेसलाई ग्लोबली कसरी कम्पेटेबल बनाउने होइन, कसरी कम्पिट गर्ने उनीहरूसँग, त्यो कम्पिट गर्नको लागि के हुन्छ, कस्ट लागत हाम्रो कम्पिटिटिभ हुनु पर्यो, गुणस्तर कम्पिटिटिभ हुनु पर्यो, अनि मार्केटिङ पनि कम्पिटिटिभ हुनु पर्यो। अब मार्केटिङ कम्पिटिटिभ भनेको त के, हामीले यो म्यानुअल अथवा सम्भव त छैन, त्यसमा पनि रूपान्तरणकारी कुरा आयो, ट्रान्सफर्मेसनको कुरा आयो। त्यस्तै अब गुड गभर्नेन्सको कुरा, अब गुड गभर्नेन्स अझ पनि अनुभूति छैन। अहिले एकछिन अगाडि पनि यहाँ छलफल भइराखेकै थियो, जस्तै अब ठिक छ, हामीले उसमा अब यहाँ गुड गभर्नेन्सको कुरा हामी गरिरहेको थियौँ। गुड गभर्नेन्स मिन्स के हुन्छ कि जनताले घरमा बसेर आफ्नो डिभाइस मोबाइलबाट सबै सर्भिस पाउन सक्नु पर्यो होइन, त्यहाँबाट सबै काम गर्न सक्नु पर्यो। त्यो अवस्था अझ पनि पुगेको छैन, कारण अहिले पनि हामीलाई थाहा छ पासपोर्टको लागि नेसनल आइडी छ, त्यो त डिजिटाइज भइसकेको कुरा हो। नेसनल आइडी भए पनि तापनि के छ, पासपोर्टको लागि छुट्टै अप्लाई गर्नु पर्यो, ड्राइभिङ लाइसेन्स छुट्टै अप्लाई गर्नु पर्यो, भोटर आइडी छुट्टै लिनु पर्यो, ठाउँ ठाउँमा हामीले गएर दुःख बेहोर्नु परेको छ। त्यसै कारणले गुड गभर्नेन्सलाई के छ, फोस्टर मतलब यसलाई कसरी डिजिटल रूपान्तरण गर्ने। त्यसपछि एन्स्योर एक्सेसिङ टु इन्फर्मेसन टु अल, यो पनि एउटा ठुलो एजेन्डा छ। जुनसुकै हेल्थको होस्, एग्रिकल्चरको होस्, शिक्षाको होस्, अथवा चाहिँ अरू कुनै गभर्मेन्टको, बिजनेसको, ब्याङ्किङको, जुनसुकै क्षेत्रको के चाहियो त, एक्सेस टु इन्फर्मेसन। त्यस्तै अब यो सबै भयो भने के छ, लास्टमा हाम्रो कि अनइम्प्लोइमेन्ट हट्नु पर्यो। यो सबैलाई एस्पेक्टमा के चाहियो त, रेलिभेन्सी। अब यसै एस्पेक्टमा हामीले कुरा गर्छौँ, डिजिटल ट्रान्सफर्मेसन किन चाहियो, ग्रोथ र प्रगति यो एस्पेक्टमा चाहिन्छ। अब यसैको मैले फेरि अब गभर्मेन्टले के इनिसिएटिभ लिएको छ भनेर एकछिन अगाडि कुरा म गरिरहेको थिएँ। डिजिटल नेपाल फ्रेमवर्क 2076मा आयो, अब अहिले 81सम्म छ यसको, अब 81सम्म छ, 4 वर्ष गइसकेको हो। डिएनए प्रोजेक्ट एउटा वर्ल्ड ब्याङ्कसँग काम भइरहेको छ, यसमा मेन फोकस अहिले कनेक्टिभिटीमा भएछ, सबै काम भएको त छैन, तापनि गभर्मेन्टको इनिसिएटिभ मध्ये राम्रो इनिसिएटिभ भएको कारणले यसलाई 1 नम्बरमा मैले राखेको छु। दोस्रो आइसिटी पोलिसी छ, यहाँलाई थाहा होला, ब्रोडब्यान्ड पोलिसी, ई गभर्मेन्ट सर्भिसेज, डिजिटल एजुकेसन, डिजिटल पेमेन्ट, यो चाहिँ यस्ता कुरामा गभर्मेन्टको पहल छ। म अलिक फास्टै गरेँ, अब पछि फेरि अर्को इम्पोर्टेन्ट टपिक छुट्ला भनेर। त्यस्तै अब प्राइभेट सेक्टरको कन्ट्रिब्युसन के छ त यो क्षेत्रमा, अहिले भनौँ न अब एनसेलको कति राम्रो कन्ट्रिब्युसन छ। त्यस्तै वर्ल्ड लिङ्कको कम्युनिकेसनमा छ, सुभिसुको छ, वेब सर्फरको छ, भन्नाले यिनीहरूको पनि एकदम राम्रो छ। ई सेवा अब यसमा हेरौँ भनेर सक्सेस स्टोरीमा दराज नेपाल छ, फुडमान्डु छ, पठाओ छ, खल्ती छ, ई सेवा, फोन पे, सस्तो। यसमा अब यस्ता धेरै अहिले कम्पनी भइसके, तर केही राम्रो त्यो देखिने खालको कम्पनीको मैले यहाँ लिस्टिङ गरेँ कि प्राइभेट सेक्टरबाट पनि यस्तो पहल भएको हो, जुन एकदमै एउटा भनौँ सकारात्मक देखिएको हो। त्यस्तै सक्सेस स्टोरीमा ई सेवा र फोन पे दुईटालाई मैले राखेँ। अब ई सेवा भनेको मलाई लाग्छ यहाँ नेपालमा बस्ने सबैको खल्तीमा ई सेवा एप होला होइन। अब यो सेवाको एप अब यसको कसरी युज गर्ने, के गर्ने, यसमा भन्न त के भन्नुपर्ने, यसको सक्सेस भने 50 लाख एक्टिभ युजर छ, 50+ ब्याङ्क पार्टनर्स छ, 100,000 मर्चेन्ट छ, 130,000 एजेन्ट्स छ। यसको अहिले ई सेवा एकदम सक्सेस, यो पेमेन्ट सर्भिस प्रोभाइडरमा सक्सेस स्टोरी हो। त्यस्तै फोन पे, अब यो चाहिँ यसको पिएसओको रूपमा, पेमेन्ट सर्भिस अपरेटरको रूपमा यसले नेपालमा मात्रै 1,20,000 मर्चेन्ट यसको छ नेटवर्कमा। यसका अझ थप एउटा महत्त्वपूर्ण काम चाहिँ लङ्का पे, श्रीलङ्काको, त्योसँग चाहिँ स्ट्रेटेजिक पार्टनर इस्टाब्लिस गरेको हो, यो चाहिँ महत्त्वपूर्ण कुरा छ। त्यस्तै डिजिटल ट्रान्सफर्मेसन, द नेक्स्ट वेभ अफ सोसियो इकोनोमिक ट्रान्सफर्मेसनको कुरा गर्नु बित्तिकै यसमा मैले डिजिटल सोसियो इकोनोमिकको पिरामिडको रूपमा प्रस्तुत गर्न चाहन्छु। त्यसमा 3वटा छ। एउटा डिजिटल इन्फ्रास्ट्रक्चर, दोस्रो डिजिटल सर्भिस डेलिभरी, तेस्रो सिटिजन बिजनेस एन्ड गभर्नमेन्ट, दे आर युजर्स। अब कनेक्टिभिटी र एनर्जी, डेटा सेन्टर, पिकेआई, पेमेन्ट गेटवे आदि इत्यादि डिजिटल इन्फ्रास्ट्रक्चरमा पर्छ। दोस्रो भनेको डिजिटल सर्भिस डेलिभरी। अब यो इन्फ्रास्ट्रक्चर भयो, त्यसपछि के चाहियो? सर्भिस डेलिभरीका कुरा गभर्नमेन्ट मात्रै होइन, जस्तै प्राइभेट सेक्टरका पनि प्लेटफर्म जति छ त्यो सबै भयो। त्यस्तै क्यापेसिटी बिल्डिङ कसको चाहियो? युज जसले गर्छ त्यसको क्यापेसिटी बिल्डिङ चाहिन्छ। सिटिजन बिजनेस गभर्नमेन्ट यो तिनटै जुन छ त्यो तिनटै काम गर्यो भने सोसियो इकोनोमिक ट्रान्सफर्मेसन थ्रु डिजिटल हुन्छ। अब अर्को एउटा डिजिटल इकोनोमीको अनकार्डको कुरा मैले राख्न चाहेँ। त्यसको 2टा छ पिलर, एउटा डेटा र प्लेटफर्म। डेटा भनेको नेपालको लागि एकदम राम्रो उत्साहजनक अवस्था देखिन्छ यहाँ। जसरी अहिलेसम्मको अब भनौँ नि डेटा भनेको कुनै पनि डिजिटल प्रोडक्ट र सर्भिस युज गर्ने। अब नेपालमा कस्तो छ? 100 जना मध्ये 90 जनासँग मोबाइल छ, युजर्स छ, डाटा युजर्स छ। अब पेनिट्रेसनको ब्रोडब्यान्ड पेनिट्रेसनको अवस्था हेर्नु हो भने 1,31,00,000। अब यो चाहिँ प्लेटफर्म हो। प्लेटफर्ममा युएसएसँग दाँच्ने हो भने यो युएसएको कहाँ 32 करोडमा 12 करोड छ डोमेन नेम, नेपालसँग 0.5% छ, उसको चाहिँ 37% छ। अब उसले त प्रोभाइड गर्छ, त्यो हामी युज गरेर उसैलाई डलर पठाइरहेको छु नेपालबाट। हाम्रो अवस्था यो छ। त्यस कारण डेटा र प्लेटफर्म डिजिटल इकोनोमीको 2टा पिलर छ, द्याट सुड बी मेन्टेन र प्लेटफर्म सुड बी मोर युटिलाइज। त्यसपछि इन्टरनेट युजर्सको अवस्था यस्तो छ 1 करोड। अब यो मैले यस्तै राखेँ। अब उहाँ अर्को एउटा युथको कुरा मैले गरेँ। 18 देखि 44 वर्षसम्मको उमेर समूह 44% छ। यदि मात्र 18 देखि 34% को कुरा गर्ने तैपनि 1/3 लगभग 31% आउँछ। भन्नाले 1 करोडभन्दा बढी हामीसँग युथ छ, पोटेन्सियल। जबकि एउटा नराम्रो अवस्था यहाँ छ। जबको लागि मान्छे एब्रोड कति छ? 35 लाख छ डाटा देखाएको। लास्ट इयर मात्रै 7,31,000ले श्रम स्वीकृति लिएर त्यो विदेश गएको। अब यो अवस्था भयो भने कहाँ हामी युथलाई रोक्न सक्छौँ? अर्को स्टुडेन्ट चाहिँ 4,40,000 विदेशमा पढिराखेको छन्। लास्ट इयर मात्रै 1,14,000ले एनओसी लिया छ, नो अब्जेक्सन लेटर। अब यो भयो भने त हरेक इन्जिनियरिङ कलेज यहाँ तालचा लगाउनु पर्ने अवस्था हुन्छ। यो चाहिँ एकदमै ठुलो च्यालेन्ज हो, युथलाई कसरी रिटेन गर्ने। अर्को फ्युचर आउटलुक, यो चाहिँ मैले डिजिटल नेपाल फ्रेमवर्कबाट नै बेस लिएको हो। पोटेन्सियल सेक्टर एन्ड कम्प्युटेबल बिजनेस, पोटेन्सियल सेक्टर एन्ड डिजिटल सल्युसन फर बिजनेस। यो चाहिँ यो क्षेत्रमा यो काम गर्नको लागि, अब यो मैले धेरै डिटेल गरेन, उहाँ टाइमै तोक्नु भएको छ। यो चाहिँ सक्सेस गर्नको लागि सायद यहाँ कलर नमिलेको हो, 3वटा बिजनेस इन्भाइरोमेन्ट नेबरसको रूपमा राखेको। जसरी अब स्किल डेभलपमेन्ट, टेक्नोलोजी डेभलपमेन्ट, इन्फ्रास्ट्रक्चर एउटा भयो। दोस्रो भनेको स्टार्टअप बिजनेस इन्क्युबेसन, इन्टरप्रिन्योरसिप डेभलपमेन्ट दोस्रो भयो। र यो दुईटैलाई म्यानेज गर्नको लागि पब्लिक प्राइभेट पार्टनरसिप चाहिन्छ, जुन एनआरएनसँग मिलेर अथवा चाहिँ यहाँको एनआरएन अथवा यहाँको प्राइभेट सेक्टर एफएनसिसिआई र नेपाल गभर्नमेन्टसँग मिलेर यो कार्य दुईटा गर्यो भने र तर फर्स्ट फोकस भनेको ट्यालेन्टमै गर्नुपर्छ। र यसको लागि जुन ट्यालेन्टको कुरा मैले राखेँ, जसरी भनौँ नि 1,14,000 यदि हाम्रो +2 पास गरेपछि विदेश जान्छ भने त्यो 1 लाखबाट 50% पनि राख्यौँ, 50,000 भयो भने 5 वर्षमा 2.5 लाख हुन्छ। त्यसलाई हामीले स्किल्ड गर्न सक्छौँ यसमा लगानी भयो भने। अर्को पक्ष मैले भन्न चाहेँ कि जसरी अहिले डाटा एउटा पेपरमै आइसकेको छ, 66,000 आइटीमा काम गरेको अहिले वर्कफोर्स छ। त्यसले के 67 अर्बको सफ्टवेयर सर्भिस एक्सपोर्ट गरेको तथ्याङ्क छ हामीसँग। अब 66,000बाट जब 2.5 लाख भयो भने हाम्रो कति अर्ब हामी एक्सपोर्ट गर्न सक्छौँ? जबकि अझ त्यो पूर्ण रूपमा आएको छैन डाटा। भन्नाले अहिले नै 100 अर्बको यदि हामीले एक्सपोर्ट गर्ने क्षमता छ भने यो 66,000बाट यदि हामीले उत्पादन गर्न सक्यौँ स्किल्ड युथ फोर्स इन आइटी 2.5 लाख 3 लाख, त्यसो भए हाम्रो त यो ठुलो चाहिँ अहिले पनि 1 नम्बर प्रोडक्टमा आएको, पछि त यो झनै यसले कन्ट्रीकै जिडिपीमा ठुलो योगदान गर्नेछ। यो मैले लिएको र अन्तमा मैले भन्न चाहेको कि युथलाई रिटेन्सन गर्नको लागि NRNA ले चाहिँ डिजिटल स्किल डेभलपमेन्टको कार्यक्रम नेपालमा एकदमै यसमा लगानी गर्नुपर्छ र यो अर्को भनेको सेक्टर एग्रिकल्चर, स्वास्थ्य, कृषि, टुरिज्म यिनीहरू छँदैछन् साथै। तर पहिला त गर्ने मान्छे चाहियो नि त। अब सिधै हामीले एग्रिकल्चरमा यो गर्ने, स्वास्थ्यमा यो गर्ने त्यो हुँदैन। यसो गर्नको लागि पनि के चाहियो त हामीलाई? युथ चाहिन्छ, HR फोर्स चाहिन्छ, त्यसपछि टेक्नोलोजी चाहिन्छ। नलेज, टेक्नोलोजी, क्यापिटल हिजो पनि हामीले सुन्यौँ। नलेज पनि चाहिन्छ हामीलाई, टेक्नोलोजी पनि चाहियो, स्किल पनि चाहियो, क्यापिटल पनि चाहियो। अनि त्यसपछि हामीले ठुला जुन कम्पनीहरू छन् संसारकै, गुगल छ, माइक्रोसफ्ट छ, अमेजन छ, तिनीहरूलाई हामीले वेलकम गर्नुपर्छ र त्योसँग पनि पार्टनरसिप गर्नु पर्यो। यहाँ चाहिँ प्रमोट गर्न, त्यसमा चाहिँ उधार भएन भनौँ, यस्तै हाम्रो मेन पावर बाहिर भाग्छ। किन त त्यो आकर्षण पनि हुन्छ। ग्लोबल यदि त्यस्तो ठुलो जियान्ट कम्पनीहरू आयो भने एक त उनीहरूले धेरै मेन पावरलाई इन्भल्भ गर्छ, दोस्रो भनेको के छ कि उनीहरूले कम्पिटिटिभ जुन इन्डिया, फिलिपिन्स अरू कन्ट्रीमा जुन उनीहरूले इन्सेन्टिभ प्याकेज दिन्छ त्यसमा हामी पनि उसँग सहकार्य गरेर त्यो कम्पिटिटिभ पनि हुन सक्छौँ। यो अवस्था मैले देखेको र धन्यवाद।
Yes, thank you, Dr.